Welcome to the Retreat Radio, where we go beyond temporary fixes and surface level symptom management. Here, we dig into the real root causes behind your symptoms so that you can understand your body, advocate for your health, and ask the right questions. I'm Heather Witt, physician assistant and owner of the Retreat Wellness and Aesthetics. This podcast sits at the intersection of aesthetics, longevity, and functional medicine, and you'll get information without the sugarcoating, the trends, or the nonsense fluff. Let's get into it. Hello, everybody. My name is Heather, and welcome to the Retreat Radio. On today's episode, I have a very special guest. This is our very own nurse, Brittany. She is the other injector here at the Retreat Wellness and Aesthetics. And you guys have heard all about my journey as a PA coming into aesthetics. I thought it'd be really cool to bring her on to give you a nurse's perspective and where she's heading with that. So why don't you start, Brittany, by kind of telling us a little bit about your credentials, how long you've been here, how long you've been injecting, and all of that good stuff.
I've been a registered nurse for about 1.5 years, but I've been part of the retreat for about 2 years. So I started off as a patient care coordinator, and then we kind of transitioned into that injector role. So I've been seeing patients for about 1.5 years now. But more of my background is I graduated with my bachelor's in kinesiology, and then I went on for a direct entry MSN, which is a different route.
So what is MSN? Because this is something I always get all confused about. I just call it alphabet soup. All these nurses have all these letters after their name. So what does that mean?
So I got my master's in nursing.
Okay. So like BSN, Bachelor's of Science Nursing, MSN, Master's of Science.
Right.
Okay.
Which was actually the same alma mater that Heather graduated from.
Oh, yes. Yes. I always forget that.
Yeah. I like to think that was like a good point in my resume.
Yes. That actually, I do remember that. I was like, oh, that means I know she went to a good school.
So yeah. I started here and then just kind of learning the ropes of everything as a patient care coordinator, which I feel like really was imperative to my role as an injector. And then I was just so happy that you took me under your wing.
Yes, it's been fun. The longest you've been is seeing dysport patients, neurotoxin patients. And then you kind of transitioned into all of like the skincare treatments. So like all of our microneedling, our laser, like our PRF injections and things like that under the eye. And then most recently we've transitioned more into like Sculptra, fillers, full facial balancing. Yeah. So kind of that like stepwise process of that learning curve.
Yeah.
Okay, well, I just have questions for you today to kind of go over your experience with getting into aesthetics, because I think it is really a booming career path right now. And I think it's also very popular among nurses to they're starting to leave bedside, they're getting burnt out, and they're wanting to get into injecting. So I thought, asking you some questions from your perspective on how you did it and how you got here and your journey and your experience might be really helpful to a lot of the kind of newer people to this industry listening.
Yeah, absolutely. I mean, I know you guys did an episode on like your journey as a PA, so I feel like it's really important to see a nurse's perspective and also just a new grad in general. So yeah, I'm excited.
Let's get started. Let's jump right in with the first set of questions. Okay, so why don't we just start with you, first off, just giving us a little bit of your background and kind of the path you took to get to where you are today.
Yeah, I feel like my path is a little different. So right out of high school, I went to Cypress College and I did 2 years there to get my prereqs. And then I transferred to Cal State Fullerton and I actually graduated with my bachelor's in kinesiology. I originally thought I wanted to get into some sort of PT athletic training. I had played sports my entire life, so I feel like to make a 17-year-old decide what they want to do for the rest of their life is a lot of pressure. So at the time, I was like, okay, sports. So that was the route I did. And then it wasn't until like my junior year where I was talking to my counselor and we talked about, I was like, I don't want to do this anymore, but I don't know what else I can do because I have so many science courses that I've taken. And so she gave me a list and nursing was one of them. And I just started Googling with my friend, like nursing jobs. And then aesthetics popped up. And then I just went down this whole rabbit hole of aesthetic nursing. And I started looking up like days in the life of injectors. And I was like, this is what I want to do.
So you knew that you wanted to go into aesthetics before you went to nursing school?
Yeah.
Okay. So you kind of had that end goal in mind.
Yeah.
Okay.
I remember we still talk about it to this day because we joke that we decided our careers in that little like study hall area. And I just never looked back. And then I applied I was already so far into my bachelor's degree that I just decided to complete that. And then I took the remaining courses for my MSN program. I did a direct entry MSN program because at that point, I didn't want my bachelor's to feel like a complete waste. So I almost used it as a stepping stone to just go for my master's.
And why did you, because you can get into aesthetics with just a BSN. I think it's difficult to get into a hospital with just that, but I think you can. But what made you decide to pursue the MSN and not just stick with bachelor's, be done quicker, and then jump right into aesthetics?
I think a big part of it was just I didn't want to feel like my bachelor's kind of went to waste. So like I said, I wanted to use it to my advantage because you needed a bachelor's to apply for a master's program.
Okay.
But I also knew that I wanted to, if I was going to pursue this career, I knew that I at one point wanted to go back for my nurse practitioner. And so regardless, I needed my master's. So that's kind of why.
So you had mentioned that you also eventually want to go for your NP or your nurse practitioner license. I think that that's a common question a lot of nurses in aesthetics ask themselves is, should I go for my NP or not? Do I really need it? What's it really going to do for me? So why do you want to do that additional education, and what's your advice on if you should do it or not?
Yeah, I mean, that was always part of my plan, which is why I did the direct entry MSN route versus like an accelerated BSN, was because my end goal was always NP. I just feel like there's a level of like just independence that comes with that role, but also just a higher level of care, higher level of education that comes with that, and just experience that I feel. Because you also, I mean, this is also like a controversial take because there's a lot of people that go to NP school right out of nursing school, and different programs require different things. But I also felt like it was really important that I got that ER bedside experience first before I applied.
Gotcha. I think that in aesthetics, it's a little bit different. It's a lot a bit different than the hospital, right? I feel like in aesthetics, your actual role as an injector doesn't really change too much. You're still doing all of the same things. It's more on like the back end.
Yeah.
So from an employer standpoint, it is a lot easier if you are an NP, because I think a lot of people forget when they go into aesthetics, as a nurse, you cannot diagnose, you cannot prescribe or anything like that. And technically when you are dosing Botox or Dysport or things like that, those are drugs, those are medications, that's dosing. And so there is kind of this gray area in aesthetics where somehow we're still able to get around it and you're able to do it. And we have things like standing orders to allow that, but it's a lot more trickier. And if you're opening your own med spa as a nurse, there's a lot more legal paperwork and things that go into it. And then as a nurse practitioner, not in California yet, but in a lot of states, as a nurse practitioner, you can have independent practice.
Yes.
So something that PAs really have not worked towards much yet. So, we still need supervising physicians to, basically have somebody to collaborate with. So in some states like Arizona, you could have total independent practice. You don't need a supervising physician. And so that's very beneficial for you in terms of an aesthetic practice. But I think day to day, like seeing your patients, besides what you mentioned of like, having that additional education and like the work ethic you put into that, your role doesn't change a whole lot. What do you think about in terms of like pay? Do you think it's beneficial for pay?
I think aesthetics pay is a lot different than like a hospital pay, at least for RN. So I would assume it's also different for NPs. So I feel like it's probably not the traditional pay structure.
Yeah, I would agree. I think
I don't know.
I think it varies state to state again, because in some states, nurses are really limited to what they can do. I know in some states, like a nurse can like barely even do a laser, they say. So they can't inject and so a lot of some states, like a nurse will just be doing procedures or things like that, and they're not actually injecting patients. And so I think getting your nurse practitioner, then you're able to do that. Obviously, your pay is going to go up. I think like in a state like California where we are, especially if you're in a practice that pays more so on a commission base, which is more common, your pay is really going to be determined by how many patients you see and what kind of procedures you are doing on them. So I think there is a level of base pay that can somewhat change, but it varies practice to practice.
Yeah, I've heard different things. So I think it just depends on the practice, location, state.
Yeah. Well, I have to say, from my perspective, I'm really excited for you to get your NP because, again, it's a lot less paperwork nightmare, and it's not so much dancing on this, okay, are we in compliance, are we not?
Mm-hmm.
And I think it does make you a more desirable candidate.
I agree.
So I think a lot of places would rather hire a nurse practitioner than a nurse
Mm-hmm.
in the aesthetic field.
Mm-hmm.
Okay, so now you've got your MSN, you've finished school. Tell us a little bit about your process that you went through for trying to get your foot in the door and get a job in aesthetics now that you have this new fancy degree.
So I feel like that goes way back because I had been applying for like MA positions, front office, anything since like 2017, 2018. And it was so hard because at the time I had no experience in any of that. So I was just applying for jobs that I clearly wasn't qualified for. I didn't have an MA certification or anything, but I was applying to med spas, dermatology offices, literally anywhere that I could try, which is funny because I applied at the previous med spa that you were at.
Oh, yes, I do remember this now from your interview. Yes.
Which I didn't get. And I mean, like looking back, I'm so happy that everything worked out the way it did because who knows how different it would have been. So I had been applying for years and I never.
So did you have any certain, like when you were coming new into it, were you very picky about where you applied or what you were looking for? Or was it just kind of like, I just need to get in somewhere and start getting experience and then I can kind of find my home later?
It was a little bit of both. I have this memory because I went to my best friend, she does jewelry, and so I went to an event with her, and one of the guests was already a nurse and she worked in aesthetics, and I was telling her like, oh yeah, like I want to be an aesthetic nurse, and she was very quick to say like, oh well, you're gonna have to start at some big chain that's super toxic, and like she was like warning me, but she sounded like it was just like a rite of passage into the industry. And I just remember thinking like I hear you, but I know I'm going to find like my right spot. And so then after that, I had seen that you posted your new account and that you were hiring for a patient care coordinator. And I texted Nicole and I was like, I have to apply to this. So it was a little bit of both. Like I was applying to different places, but I was also like more excited for certain ones, if that makes sense.
Yeah. Yeah. It's funny because that is a piece of advice that I always give. Not necessarily advice, but it's what I always say, where when you're new in the industry, you just have to take what you can get. And oftentimes you are only going to get hired at, like a chain or one of those places where you know that that's not where you want to stay forever. Yeah. It's not the best place, but at least you can start getting your experience. Because unless there's something extra special about you, which obviously there was about you, which we'll get more into that, it's highly unlikely that you're going to get into like your dream med spa job like right out of school, because it's a lot to build somebody up from ground zero and fully train them on how to inject with no experience, no patient book. And so a lot of places are sometimes not willing to take that on, especially if you've never even worked the front or been an MA before in a med spa. So it's funny that you said that, because that's usually what I say a lot. But yeah, we all know it worked out much differently for Brittany.
Yeah, and I remember just like from like the second that I found aesthetic nursing and it was a lot of those days in the life like on YouTube where I knew one of the hardest parts at that point was just getting in. So I was fully prepared for that. I'm glad it worked out.
Something that I've always been curious to ask you, which I think would be a great place to do it, is what do you think it was then, like in your mind, what are some of the things you did, or what do you think about you that it was that set you apart, that made myself go for you when I had told myself, I'm hiring front desk, I'm not hiring a nurse, I'm not hiring somebody who wants to eventually be an injector or be an esthetician. Like, this is what I want. And then I came across you and I was like, there's something here. So what do you think that was that you could maybe give advice to other people that might help them?
It's a great question.
You're like, I don't know, I'm just awesome.
I think my biggest advice with that would be that I would hope that you were able to see how passionate and how bad I wanted it because of how seriously I took the video. So they had asked me for a video.
Mm-hmm.
And I remember being in class, and like, this was a very strict program. So we had exams basically we had a quiz every single day. And so as soon as we finished our first quiz, like, I started making like a whole template of what I wanted to say in the video and like all the points that I wanted to come across. So I went into that video like fully prepared. And so I feel like looking back now, I know that that was kind of like a test to see who took the job seriously.
Yeah, because in aesthetics, like, you need to be serious. You cannot be cocky. You cannot think, oh, I'm all that, I'm above everything, I know everything already. You have to humble yourself. And so there's a difference between coming into a med spa and being disrespected as a new person and still knowing that you have a lot to learn. And so that is one of our first tests during our application process, is who is willing to put in the effort. We basically just ask them to make like a little video and send it to us, answering like 5 simple questions. Honestly, I don't really care what they say in the answer to these questions. It's more, are they willing to put in the effort, and does it look like they put in the effort to answer the questions nicely and not just read off some screen? Does it sound AI? Things like that. So because most of the applicants probably think, I don't have time for this, I'm too good for this, this has nothing to do with injecting, like, I can go somewhere else. And I'm like, fine, go somewhere else. So I could tell when I looked at Brittany's video how seriously she took such a small task. And that fine attention to detail, I think, is so important when you are going to be taking a needle to somebody's face. So knowing that we've already covered that, you know, in the beginning, you can't be too picky where you get started. Still knowing what you know now, what are some like major red flags though you should look for as a new applicant trying to get into a med spa?
You mean in general, or like as a nurse?
Yeah, like if you went in for an interview, or like, you know, at the end of an interview, they usually ask you, like, do you have any questions for us? Or like, what are some things in the employer or the med spa or the team that you look at that maybe like, okay, that's too much of a red flag, maybe you should be cautious of that?
I mean, I didn't get any red flags, so I feel like it's easier for me to talk about the green flags that I got. I think going into it, I knew you guys were such a small team, which I already really liked. And so I felt like if this group of 3 people was going to bring on someone else, they were being a lot more picky, I guess. And so I mean, I could tell by the energy when I came here and the types of questions that you were asking me, but you were also letting me ask questions. And so I feel like that was really important too.
Mm-hmm. I think for me, something that I always try to strive for anytime I'm in an interview process, when I'm interviewing somebody, is, I'm sure you remember this from your interview, I always try to let you know that like, this is a respect situation.
Mm-hmm.
I am not better than you. You are not better than me. This is a team, right?
Yeah.
We need to work together. And so at the end of the day, yes, like, I own this place and I make the final decision, but I always want you guys to be a part of that decision, because I can't know everything.
Mm-hmm.
I can't think outside the box about every little thing that we do. And so I always, you know, tell you guys, like, if there's ever anything that I need to work on to make your job easier, please let me know.
Yeah.
So I think, I mean, that is more of a green flag. But I think if you're going in and you're interviewing for a med spa where it just seems like they don't have a lot of their shit together, for lack of a better word, or they're offering you like ridiculously disrespectful pay, or the person interviewing you, you can kind of tell that they have that same like know-it-all, like, I'm the
also,
head honcho here.
If you looked crazy, that would have been a red flag.
Oh, that's actually a really, really good one. Yeah.
So I feel like that would have been, because I feel like as a new, first of all, new grad, new injector, maybe I shouldn't say this, but like, I didn't care what you paid me because I just wanted to get in. You know, so like that's not something that I was really like, oh, that would have been a red flag, because I also don't know. So it was more me trusting you.
Yeah. But yeah, if I'm about to train you and I look like I don't know when to put the syringe down on my own face, you're kind of like, are those the techniques that I want to learn? Because that's not what I want my patients to look like.
Right.
That's a very good one. I say that one all the time, actually. So you didn't think I looked crazy?
Clearly not.
Okay, good. Okay, I just want to go back because I think you actually made a really good point that I didn't think of, because, you know, I was saying like, oh, if they're offering you crap pay, like, run away. But I really do feel like that is more for a seasoned injector, when you know your worth at that point and you're trained. And you brought up a good point saying, I just wanted to get in.
Yeah.
I just wanted somebody to train me and teach me. And like, I didn't care what I was going to make. Like, and that's what I saw in you, is that you were like, honestly, you probably would have like worked for free if I just would have given you the time of day. Right.
Yeah.
And so she didn't work for free. Let me just clarify that. But that's a good point because I think that still is a good red flag though of something to keep in your mind. Like, hey, this probably is not like an appropriate pay of what, they might be taking advantage here, but at least I can get my foot in the door so that at the next place I can go in and say, hey, I have this many like years of experience. So just like maybe knowing the red flags, but not necessarily like saying no to a job because of that.
Mm-hmm.
All right, I want to move a little bit more into like once you start, just to give maybe some newer injectors out there, like maybe if they're in the process of a month in or something, just some of the things that they can expect to maybe be normal or not normal. But what is one of the things when you first started working with us then, or about aesthetics, that just in general really surprised you?
Okay, so something that really surprised me about aesthetics, well, I think also just any business, is how much work goes into a business. Like all the everything, ordering product, how much product is, patients, following up with patients, emails, reps, relationships with reps. There's just so much that I had no idea about. And I don't know if that was also more like a bigger shock because I could really see it coming from a smaller business. I mean, I knew there was back stuff for everything, but just seeing it from this view was a lot.
So you mean the patients don't just call and show up in your chair?
Yeah, like...
And like, oh, everything's sunshine and roses, and then like leave you a 5-star review and come back every 3 months? Like that doesn't just like happen on its own?
Yeah, and in my head, I'm like... I think I thought too, just a lot of it is there's a person. Like it's not just like a computerized thing or no one's following up unless we're following up, and there's just a lot that I had no idea.
Yeah. It really actually warms my heart that you notice that part of it, because that is something that I think a lot of people, they come out of their bedside job or their job in the hospital, PAs, NPs, nurses alike, and they're just like, I'm just going to open a med spa. It just seems like such a great moneymaker and it seems so fun. And I think they quickly realize, what you realize. So, but I'm even glad just from an employee's perspective that you were able to see it.
Yeah, like honestly, props to you because you really like keep everything in check, but there's so much that goes on.
Yeah.
That I don't think many people know.
I think that would also be good advice to new people as well as, I'm very open and transparent with my team and I let you guys in on the numbers and you see me every day doing all of these things and we have meetings about it, right? But I think a lot of other like larger med spas, I think that the owners keep all of that separate, right? Mm-hmm. And so sometimes as an employee, you don't realize all that goes into it. And so sometimes you can get a little bit upset, like, well, why are they doing this? Why are they doing that? Why do we have to do this? Why are they only paying me that? And so I think maybe that's some good advice is just to know and trust that there is a lot going on behind the scenes that you may not know about, that we're not out to get you or to be mean.
Yeah. I also think another thing is people don't realize how, I think in aesthetics, one of the first things that people think is how expensive these treatments are, but they have no idea how much it costs us to get these products. Mm-hmm. Where like, it's still a business, so you still have to make a profit, and then you still have to pay an employee, and then there's a commission, like there's just so much.
Yeah. I think that's an excellent segue into another question I had for you, because you've even come and told me this, that you hear all the time at your other job that like, oh, like I just want to go, I'm just going to go open a med spa and I'm just going to kind of do this on the side, like one day a week. And, I just think it's going to be so great. What are your opinions on that? Or what do you think of that when you hear that? Or what is maybe some advice that you might want to give them?
Advice for people who like plan to go into aesthetics?
Or like the kind of the trend that we're seeing or that you even see at the hospital you work at, where people, they just want to kind of just go and start their own med spa.
I think it's a bit of like they want to open a med spa, or they just want to get into aesthetics because they think it's going to be this like really easy side job. So I think that's where I would give advice, like this is not a side job. And so that kind of goes into why there was 2 jobs full time, because there's a lot that goes into it. There's a lot of social media. There's a lot of just reaching out or talking about yourself everywhere that you go. I've heard comments too where it's like when they choose an injector, they're also looking at social media, or they're also looking at how often they work there, because if they're going to someone who kind of talks about aesthetics here and there and they're just going once a week, that makes them trust them less when they know they have like a second full-time job, I guess. Yeah.
Do you feel like you would be where you are today in your injecting career if you had only come here and worked like 1 or 2 days a week?
No.
Why do you think that is?
Yeah, I feel like I wouldn't be where I am had I not even worked the front desk. I feel like that helped create a lot of the relationships I have now with my patients, and I felt like it was like you said, an easier transition for them to trust me.
Yeah, that's a really good point, actually. I think a lot of people would, well, I have this big fancy degree now. I want to inject. I don't want to work at the front desk. But I think that actually contributed a lot to your success when we transferred you over, because number one, you already knew how everything ran here. You knew how to check people out. You knew the pricing on everything, and you knew the patient. You developed a relationship with them. And so they trusted you. A big thing we always say is your patient needs to know, like, and trust you. So you already had most of those bases covered before you even brought them into the treatment room.
Right.
Okay, so I don't know if everybody here knows, but Miss Brittany here not only worked 4 days a week out the gate here working in aesthetics with us, which in the aesthetic world is considered full-time. Most injectors work about 4 days a week, and when you're seasoned, maybe 3 days a week. But in addition to that, she worked 3 12-hour shifts at the hospital. So she worked 7 days a week, and she did this for an entire year, her first year out of nursing. So first of all,
thank you.
Wowza, that was something that I really looked up to you for, and I literally don't know how you did it. But talk a little bit about, number one, why you chose to do that if you already had a full-time job in aesthetics and that's what you wanted to do, and how you feel like that maybe helped you.
Yeah, I feel like another thing that people don't realize with aesthetics, or maybe they do, but they just underestimate it, is you're not going to make what you think you're going to make in aesthetics for a while. And I've heard people tell me that it takes almost like closer to 3 years to really build your books.
Yeah.
And I was completely ready for that. And so I knew that the reason why I did too was it goes far back because I felt like there was these 2 amazing opportunities that I couldn't pass up on, because I had done my preceptorship in the ER. And so when I graduated, they had offered me a position, and then I was also working in aesthetics, and I felt like I couldn't give up on these 2 specialties that I know a lot of people try to get into, and I couldn't say no to either of them. And so I kind of I wanted the experience in the ER. I wanted to improve my critical thinking skills. I truly wanted to provide like the best patient care overall. And I felt like the ER was a great way to kind of learn a lot of that. A lot of it was just I didn't want to take that opportunity for granted. I got day shift in the ER as a new grad.
Yeah,
and then I got
insane.
Aesthetics. So I feel like it was so clear to me that I just had to do both.
Yeah.
And so I mean, I'm so grateful for you because you were so accommodating and flexible with me, and just my family. They were super supportive and just helping me.
Yeah. I think this is one of those things I said where I could see that quality in you, that you have that hunger and that drive, because you understood that if you want to be successful in aesthetics, you can't do this once or twice a week, right? You need to dive into it because you need exposure, you need experience. And so, you know, working 3-4 days a week in this, that's great. But you also understood in the beginning that's probably not going to pay the bills. And I think for you, I've come to a point in my career where, yes, I'm a PA. And yes, if you have a heart attack on a plane, I probably can't save you because I'm like strictly aesthetics now. But I wasn't always like that, right? And I think for you, that was also really important to hang on to all that work you did in nursing school and to have that medical background as well. So the fact that you were willing to sacrifice your life to work 7 days a week for a whole year, that just shows how badly you want this. And yeah, I just wish more people had that work ethic.
Thank you. Mm-hmm. Yeah, I don't regret it.
Okay, good. Okay, so I just have a couple more for you. The first one is, what is the most rewarding and also the most challenging thing about working in aesthetics?
Most rewarding, I feel like that one's kind of obvious and a little cheesy, but just like seeing a really good outcome from a patient or getting a really sweet review, especially as a newer injector, because you're going through this like imposter syndrome. And so to see someone who took the time to write a review is the best feeling. Also now I'm hearing more and more of like, oh, my friend told me about you, or my friend told me about this. And like, that's a whole new compliment that I hadn't heard before.
Yeah.
I guess the most challenging part to me in aesthetics is more like an umbrella of just like a complication, but just a patient not being happy.
Or maybe even like the fear of going into a treatment that they may not be happy even before you start the treatment.
Yeah, I feel like there's also a whole new anxiety with aesthetics that I didn't expect. For example, like with Dysport, for 2 weeks, I'm kind of like, oh my God,
Like, is the brow going to drop? Is something
yeah,
gonna happen?
and like as I'm injecting, you just become more confident in it. But it's in the beginning, like that was just, I didn't think I would be anxious in aesthetics, like I think it's little things like that.
I'm glad that you can recognize those things because again, that's what sets you apart from somebody who comes into this just thinking, oh, I know what I'm doing. This is easy. It's sunshine and roses.
Yeah.
Because you can hurt people.
It's definitely like the amount of time I'm spending thinking about patients that I didn't think that's how aesthetic was.
Yeah. So tell us, Brittany, now that you have been injecting for some time, what is your favorite treatment to perform?
Okay. I love Dysport. I love lips.
Can you tell them what Dysport is?
So Dysport is a neuromodulator, neurotoxin that we like to use. It's just a brand. We like it because it tends to last longer, it kicks in quicker, and I feel like it doesn't give you that frozen feeling that sometimes other brands can give.
What's like the biggest other brand people might know?
Botox.
Yeah.
I feel like people say Botox, but they're kind of just using it like the term Kleenex. Mm-hmm. But yeah, I love Dysport because I feel like the placement of it's more creative for me, as well as doing lips.
I know you've really taken a liking to lips, and you're really good at lips.
Thank you.
Like the first lip you did, I literally just stood back and I was like, what is going on?
Yeah, I love lips.
What kind of Twilight world am I in? Like this girl just like banged out these like
I was so really ready. I was so excited for lips.
Yeah, you did really great. But I think also you've been watching for forever.
I have been watching Heather. I have been watching you forever, so
that's how I experienced it too. When I first started injecting fillers, I had been watching the person who I was kind of shadowing for like 6, 7, 8 months.
Yeah.
So I already knew like what filler to choose. I already knew like the techniques. And I think that's, again, what gave you your advantage.
Yeah, I feel like being able to shadow you and then like standing behind you, after a certain point, I would make it like a game. Like, I think she's going to inject here next, or I think she's going to go here.
Yeah.
So at that point, then I was like, I just want to like start it.
I think that then would be another good piece of advice is, again, first job, let's just get our foot in the door.
Yeah.
But when you're really looking for somebody to train you and mentor you, somebody who's willing to take that time and really take that time out of their schedule and let you shadow them, let you ask your questions, teach, talk about why they're doing what they're doing. I think that's what really excelled you to be kind of a natural when you started.
Thank you.
Yeah. So I'm not sure if you can quite remember this, because I think sometimes even when I don't realize you were shadowing or asking me questions, you probably were. But how long do you think you actually did kind of watch and learn from me, or when do you think that all started?
I don't know exactly when it started because I knew you hired me as front desk, so I never wanted you to feel like, why is she asking me to shadow?
Girl, we knew you were going to be graduating up.
No, I know, but I didn't want... I don't know when I started shadowing, but it was definitely at least a year before I like started touching people.
Okay, yeah. I would say that too.
Yeah, it was like 10, 11 months.
Yeah. I feel like I remember even back to when you were like strictly at the front. Like we hadn't even entered into, okay, we're officially training you. To start injecting, is you already were still asking questions like, oh, why are you doing on that patient? Or there were days where you'd be like, hey, I'm done with like all my admin stuff. Like, can I just come in and watch?
That's true, because I also didn't really know anything.
Yeah.
So like even being in the front desk, I didn't know like we use half syringes or what a syringe really looked like. There was still a lot that I didn't know.
I remember, I'm so glad that you like basically had the balls to ask, like, hey, can I just come watch this? Like, because it wasn't that I was consciously in my mind like, she can't come in and watch me, but like you get so busy throughout the day, right, of like go between patients that like I sometimes didn't think of that, like, hey, this would be really good for her to watch or to see. And so I'm so glad that you took that initiative, because that also then I would go home at night and be like, again, like, man, this girl wants this, like she really wants to learn, and that really helped you too.
Yeah, I agree.
All right, so in wrapping all of this up, if you had somebody approach you who was new to aesthetics and they kind of wanted to start getting their foot in the door, what is the biggest like overarching piece of advice that you would give to them?
I would say for aesthetics, you kind of just have to be very like tunnel visioned, because you're going to hear people say so many. I mean, the lady told me that I was going to have to work at a big chain. Like you're going to hear all these different pieces of advice, but I think just taking it one step at a time and just trying to get in. And like, I mean, I knew I needed my degree. So once I got my degree, then it was just like, okay, next step, get in. And then it just flowed after that.
Yeah. I heard this quote. I use it in all of my talks now. It just reminded me of that. It's never compare your chapter 1 to somebody else's chapter 7. Mm-hmm. And I think that ties in really nicely with you saying, just take it one day at a time. Like, don't get so far ahead of like, well, why does Susie have like 5 patients on her schedule today and I don't? Like, why isn't anybody coming in? And I think just, soaking it all in. Mm-hmm. I think that's great advice. So what are your goals that you have in mind for this coming next year?
My goals and what I'm excited for the next year, I think, is just continuing to grow my books. And I feel like I'm slowly noticing that. So that's been really exciting. But also just learning different techniques. I think that's also something that I've noticed about myself when it comes to like Dysport or lips. I'm feeling more confident and starting to get creative with these treatments. And so that's been a really fun part for me.
Well, thank you so much, Brittany, for coming on today. That's really all the questions that I have for you. I'm sure I'll think of a million more later, but I hope, did you have fun today? Did you enjoy that?
Yeah, I mean, I was definitely nervous, but it was nice to kind of reflect on my journey throughout this whole time.
Yeah, I think that's always a great thing to do, is look back like where you started, and it's always a good journey. So why don't you tell us actually really quick what treatments you actually are providing, and that if somebody does want to book with you, what you're providing and how they can get on your schedule.
Yeah, absolutely. I'm doing Dysport, fillers, Sculptra, microneedling, Biogel, Easy Gel. I know you've done a couple podcasts on that. The laser that we just got that I'm really excited about.
Nuvaderm. I love that thing.
We're actually having a summer promo that we'll put in your guys' podcast the show notes. But you guys can check out our Instagram. We have more details about the summer promos, but I'm really excited for them. Okay. I can't wait to meet you guys.
Yeah. Well, thank you so much for joining us today. If you guys think of any other questions that you have for either Brittany or for myself, go ahead and feel free to reach out. And then until next time, we'll see you on the next podcast.
Bye, guys.
Bye. The information shared on this podcast is for educational purposes only. It reflects clinical experience and opinion and is not intended to serve as a diagnosis, treatment plan, or medical advice. As always, please consult with a qualified healthcare provider before making any changes to your health, medications, or treatment plan. If you want to be a part of our community, make sure to follow us on Instagram at theretreat.wellness and theretreat.aesthetics. Thank you so much for spending part of your day with me today, and until next time.